All. This is Dr. Mobeen Sayed from DrBeen.com. Welcome to one more show. So this is our discussion about the COVID-19's vaccine AstraZeneca and their phase 3 trial results. These are interim results. This trial is done in US, Peru, and Chile. And let's look at the results. This is the same vaccine that has had a number of controversies. First, there were controversies around the development of the vaccine, and somebody misidentified it as to be produced in MRC5 cells, which was incorrect. It was HEK293 cells, which were human embryonic kidney cells that were aborted, I believe, in 1970s. And their cells copies are used. Then nowadays, in more recent times, there has been a scare of AstraZeneca causing thrombocytopenia or even disseminated intravascular coagulation, or thrombosis instead of just thrombocytopenia. So thrombosis means intravascular coagulation and clotting. So because of that, many countries actually stopped the delivery of AstraZeneca. AstraZeneca had one more interesting issue, and that was the half dose, full dose issue with the efficacy. And then the efficacy was taken, that was 62% in one country and then 92% in another country, and an average was done to 72%. Then AstraZeneca had one more very interesting set of events, and that was the vaccine's efficacy. Originally, the AstraZeneca vaccine in trials had been given at 4 weeks distance. There are 2 doses that are used. So these are 4 weeks apart. However, because UK had decided that they are going to deliver AstraZeneca as a single dose to as many people as possible, and then the second dose could be delayed, AstraZeneca then came back. In the beginning, I think there was some resistance. I do not know if it is from AstraZeneca or Pfizer, but in the beginning, there was some resistance that, hey, this is not how the trials were done. But then they came back and AstraZeneca said, yeah, actually, if you delay the second dose beyond 12 weeks, that is 3 months or 90 days, then vaccine's efficacy actually improves. So there were, and I have done a number of discussions on these topics in the past. So I don't feel that there is a need to discuss more. You can just go to the YouTube channel and see other such discussions. The point is that this vaccine has been less than confidence building. Still, it has been used a lot. So let's look at it. The name is AZD1222. Originally, this was developed by Oxford, so it was called CHADOX1. CH stood for chimpanzee, AD stood for adenovirus, and then OX1 was Oxford's first vaccine for the SARS-CoV-2. Then, as the partnership occurred with AstraZeneca, then the name was changed to AZD1222. I believe the name is further changed now as well. This particular interim result that we are going to look at, that is the US, Peru, and Chile. The vaccine type is adenovirus. The virus is a chimpanzee virus called AD26. Remember, Sputnik vaccine from Russia uses AD26 and AD5. So they use 2. AstraZeneca use 1 adenovirus in both of their doses. And I have done a detailed discussion about that as well, how it is built, how those adenoviruses are built, and how do they enter our cells, and how do they inject their nucleus into their DNA into our nucleus, and how that DNA then makes spike proteins. What kind of a genetic material does this vaccine bring in, or the adenovirus brings in? It brings in DNA for spike protein. That DNA, adenovirus, would go and inject it into our nucleus, and then within our nucleus, that DNA, injected DNA, will produce messenger RNAs that will come out in the cytoplasm, and they will make more spike proteins. From there, the spike proteins will be shredded by endosomes and then presented, loaded on MHC1 or 2, and then presented on the cell surface, and then they would cause the immune system response. So DNA for spike protein. Fetal cell clones, yes. So copies of the fetal cell that were aborted in 1970s, these are used to build these adenoviruses. However, in the actual vaccine, the adenoviruses are removed from those cells, and then only the adenoviruses are present in the vaccine. The cells are not. Doses, there are 2 doses. Gap between the doses, the trials are done with 4 weeks gap. However, the company comes back, and the UK government, and the way it has been used is they say, hey, greater than 12 weeks or about 12 weeks gap between the 2 doses is actually a good thing, and the efficacy increases. So effectivity or efficacy greater than 12 weeks, 90 days, 3 months. So first dose today, the next dose after 3 months, the efficacy is 82%. 4 weeks, that is this result that we are discussing today, in the US, Peru, and Chile, 79%. And we'll see this in detail. 100% effectivity against severe and critical outcomes. That is, I think, important for me for all of the vaccines. If there is an efficacy against severe and critical, that means a person will not become hospitalized, or they would not become serious, they would not become ventilated, then that vaccine is good enough. 80%, so here in this phase 3 trial, 80% efficacy for people who are 65 years of age or over. So that is also good. Again, for all groups, 100% efficacy for severe or critical outcomes. So that is actually good. And I believe this is the same thing for almost all vaccines. Storage, this vaccine, we have discussed it in the past. Normal refrigeration temperature is sufficient for this vaccine to be stored for 6 months. So 2 to 8 degrees centigrade or 36 degree to 46 degree Fahrenheit. It can be transported with that temperature. It can be stored at that temperature for 6 months. The doses administered so far, so these vaccines are not just only in the trials, these have actually gone beyond that and are actively being administered as well. So AstraZeneca, by 16th of March, so today is 22nd of March, about 16th of March, 359 million doses had been administered worldwide, I believe in about 130 countries. And then in Europe or EU, about 20 million doses. I believe UK has 26 million doses or so. So a huge number of doses has been given. So the concern of the latest concern that, hey, the vaccine is doing something wrong, it is causing thrombosis, so stop the vaccination. And I want to show you this here. So this is DrBeen.com. If you go here, COVID-19 vaccine AstraZeneca, this is European Medicine Authority. COVID-19 vaccine AstraZeneca benefits still outweigh the risk despite possible link to red blood cell clotting with low blood platelets. So if you see here, what they are saying is there are rare cases, around 20 million people in the UK and EEA had received. So I think the number, that 20 million includes UK, it's not separate. And EEA had received, and EEA stands for European Economic Areas, had received the vaccine as of March 16, and EMA, this European Medical Authority, had reviewed only 7 cases of blood clots. So out of 20 million, 7 cases of blood clots in multiple blood vessels, that is called disseminated intravascular coagulation. So in all the blood vessels, or majority of the blood vessels, or a lot of blood vessels, there is thrombosis, clotting inside. And 18 cases of cerebral vascular sinus thrombosis. So the blood sinuses in the brain and in the skull that drain the blood from here, thrombosis or clotting in there. So 18 cases plus 7 cases is what they have measured in out of 20 million cases. And I think that what they have been saying is this is a similar ratio of the clotting as occurs normally as well. I still believe that the vaccine does poke it. The question is, do the people survive? Are they okay? Are they protected, saved? If that is the case, there is a severe outcome, but they are saved. That doesn't mean I'm saying that you should take this vaccine or not. If you're an anti-vaxxer, you're going to pick up this message and say, this is horrible. If you are somebody who's going to take vaccine, you're going to become concerned. So I'm not sitting here advocating that you should take it or not. I'm presenting data. So this concern, according to European Medical Authority, is not as big a concern. All right, so continuing on. Now let's look at the data itself, the trial itself. So I'm going to go here. All of these links are in the description. This is the link to the description for the trials that occurred in UK, Brazil, and South Africa. So 3rd February. We have already looked at this before. Now today, this is the link that has the data. Again, this is not the data that is by some neutral organization. This is the AstraZeneca's own site. So this is their data. Their punchline is the following. The summary is this: 79% efficacy all around, 100% efficacy for severe and critical, and then 80% efficacy for folks who are 65 years of age and above. So let's now look at this data here. They had a total of 32,449 people participating. The number of vaccinated folks were twice the number of placebo. So the ratio was 1 to 2. Does that ring a bell? A few days ago, CDC had talked about some ivermectin trial in which they said the ratio was 1 to 2 and it should have been 1 to 1. And that is an imbalanced grouping and we don't like it. So here we have a ratio of 1 to 2. Of course, now they'll be fine with it. So demography and results. So out of those folks over here, if you see, 21,000 folks were about 21,000. I am doing these numbers by doing the division. So exact numbers will be different as the data comes out. But I'm sure that it is only going to be 1 or 2 people, give or take. So 21,633 people were vaccinated. Out of the whole group of 32,000 something, 20% of the people were greater than 65 years of age. So that means about 6,600 people. And out of them, once again, 1 to 2 ratio. So about 4,400 people were greater than 65 years of age and were vaccinated. Out of these 20%, 60% of them had comorbidities, which means about 3,960 people greater than age 65, greater than or equal to age 65, were with comorbidities like obesity or diabetes or cardiac issues and so on. 1,980 out of them were vaccinated. I don't think it's a huge size, but still it is a decent size. And the efficacy in that group was 80%. So good. This, I am not too much fond of this breakdown. Out of all the people, 32,400 something, or let's round it to 33,000. 79%, about 80% were Caucasians or whites. Then 8% blacks or African Americans, 4% Native Americans, 4% Asians, 22% Hispanics. So I feel that this representation is quite low. But at the same time, I think that we are all aware that some communities are afraid of taking part. They are hesitant, they are nervous about taking part in these trials, especially the African American community. And they're correct in their concerns because of the history of how in the previous times in the US, during the time of slavery, it was said that African Americans have thicker skin and they feel less, and their nerve endings are not as sensitive, and they do not feel pain as much. And because of that, there were so many tests done on them without anesthesias, and tests done, experiments done. So the in the past, the experiments that needed human participations, even surgeries for gynecology, these were unfortunately done a lot on African Americans. And the slave owners used to write down the right to the slave to be used for experiment or for that trial. So I think because of that, there has been a lot of concern and a valid reason for for this community to be nervous and hesitant and have a mistrust. The result of that is that at this time the representation is lower, which again is actually it affects that negatively as well, because this community is affected more by the virus as well. So anyways, that was a side note. 79% efficacy to prevent symptoms, 100% protection, so I should have written percent here, from severe and critical. Total 141 symptomatic patients were seen, and again their division was such that the efficacy was 79%. So this is the discussion for today. I am going to stop that over here, and we would then do the chit chat. So my request to you is that please like, subscribe, and share. There are 3 links in this description. One is to buy me coffees, another one is for the Patreon, and third one is to support this work if you like to. So thank you very much, and I would see you in a few minutes again.